You have a diagnosis of cancer, and there's all this fear, and there's apprehension, and you're nervous and you're scared. You've got surgery in front of you. You've got quality of life issues ahead of you. What I wish I had known was that you can come out the other side of this journey.
When I was first diagnosed, I was very overwhelmed, and MSK really helped me to get organized.
The truth is, when you hear someone say cancer, after that, all you hear is like the deafening sound of as if a bomb had gotten dropped near you. You're not going to remember most of what's said.
You're meeting with a lot of different people. So what I would really recommend to patients is just do your best to take notes.
Come to the appointment prepared. Come with questions.
I had questions about my recovery. I had questions about the possibility of chemo. I was placed on a clinical trial. I had questions about that.
Prior to coming to MSK, my wife and I had been to a variety of different doctors, and we got a lot of different answers and no clear direction. It was the first time that a definitive plan was put in place where I actually had a recommendation of which way to go.
My care team consisted of doctors, social workers, nurses.
It's not just one doctor you're dealing with all of MSK and their entire team approach to your care.
I was told to expect patient-centered care, and I kind of felt that from the beginning, from that first day that I walked in.
There were even people there just to hang out with me and to kill time.
When I first got to Sloan, they actually sent me to the metastatic group for younger women. And I walked in, one of the ladies was talking about her upcoming 10-week trip to Africa. And it was like, okay, I don't have to stop living because of this. Life doesn't stop, it just changes.
If you need something, ask. And even if it's something small, like nothing tastes good or everything tastes awful and I can't eat any of this, it's important to tell someone and they can help you address your needs as a patient.
And you have to let your team know what's important to you. I know for a lot of women the biggest, scariest side effect is losing your hair. And not all chemos cause hair loss, and you might be eligible for one that isn't.
I immediately used a nutrition program because it was amazing. I used their PT program. I used their Visible Link program, which is wonderful, and it gives you tremendous emotional support.
There's my MSK Patient Portal. Most of us just call it the portal. And it's where you can go to get information about your appointments. You can keep track of medications you're taking and when you take them, which is very helpful if you're taking any sort of oral therapies. You can have communications with your team.
I never felt that I couldn't call someone, even if it was the doctor's nurse, and just talk.
The silver lining from being diagnosed with cancer is I taught myself how to be positive.
Cancer is such a scary diagnosis and such a scary word that you think everything's over when you hear it, and that's just not the case.